hope my slides are visible. Okay. Today, I want to talk about something we don't often treat like a medical condition, but maybe we should. Social isolation. Sometimes I don't talk to anyone all week until I come downstairs and see you all. One of the residents I worked with told me this during a quiet moment between being around. And what struck me wasn't what he said, it was how normal it sounded to him. He wasn't exaggerating, he wasn't saying it for effect. He was describing his reality. He lived in a building full of people and still felt completely alone. And once we started paying attention, we realized this wasn't an isolated experience. It was happening again and again. Because we talk a lot about access to healthcare, but what happens when the problem isn't access? What happens when the problem is connection? This was at a senior living community in Atlanta called Oasis at Scholars Landing. It's an independent living facility for older adults, most of whom are Black, with a high burden of chronic disease. Many residents are managing conditions like hypertension, diabetes, arthritis, depression. But what stood out most to us wasn't just the presence of disease, it was the presence of disconnection. Even though people lived physically close to each other, there was very little meaningful interaction. Some residents told us they could go days or even a full week without having a real meaningful conversation. And this investment isolation has consequences. This is where the science really supports what you're seeing. Loneliness isn't just an emotional experience. It's a measurable physiological and clinical. It has measurable physiological and clinical effects. Large studies have shown that it increases mortality risk by up to 30%, which is comparable to major risk factors like smoking. It's also associated with depression, cognitive decline, even dementia. And importantly, people who are socially isolated tend to use healthcare systems more. They have more emergency visits, they have more hospitalizations. So this isn't just about quality of life, it's a real, measurable health risk. Yet, despite all of this, in medicine, we are trained to treat what we can measure. We treat hypertension, we treat diabetes, we treat depression. But what about social disconnection? We rarely screen for it, we rarely intervene. And yet, it may be one of the most powerful drivers of health outcomes, especially in communities like Oasis. At Oasis, this didn't exist in isolation. Social isolation was deeply intertwined with other social determinants of health, like transportation barriers, food insecurity, limited access to healthcare. These are not just background factors, they shape how people live, how they access care, and ultimately how they experience health, how they experience health care. So, just to take a step back for a moment, this work was part of a community health project through Morehouse School of Medicine, where we partnered with Oasis over several months. And as medical students, our goal wasn't just to observe, it was to engage with the community, to understand their lived experiences and work alongside them to identify meaningful ways to improve health and well-being. And this wasn't a one-time event. We were there consistently, week after week, building relationships and learning directly from residents. Our approach was guided by a needs assessment that identified social isolation, limited access to care, and barriers like transportation and food insecurity as key challenges. So we asked ourselves, what would it actually look like to address this, not just clinically, but at the community level? And the first thing we did was listen. We conducted focus groups, interviews, and surveys, not to impose a solution, but to understand what residents themselves, what they felt was missing. And what came up repeatedly wasn't just medical concerns, it was connection. So we built our interventions around that. We introduced chair yoga and mindfulness sessions, not just for physical activity, but as a shared experience. We created nutrition workshops, not just to educate, but to bring people together. And we organized community health fair, which ended up becoming one of the most engaging events. But looking back, I don't think any single intervention was the most important part. I think the most important part was consistency. The fact that we showed up every week and over time, that's showing up started to matter. Here's where things get a little bit interesting, because from a traditional research perspective, our study was underpowered. We had a small sample size and our results were not statistically significant. We captured our results and the impact of our intervention with pre and post surveys. And that's usually where a project like this gets labeled as unsuccessful, but that's not what we experienced. What we saw was the residents started staying longer at events. They became more engaged. They began to recognize us, to expect us. Some even asked us when we would be coming back. One resident told me, it's the silence that's the hardest. And that's not something you can fully capture in a survey. That's not something a p-value can reflect, but it is something that matters. So this led us to rethink what success actually looks like. Because if you're only measuring short-term knowledge gains or survey responses, we might completely miss the real impact. Connection takes time, trust takes time, and those are not always immediately measurable, but they are foundational to health. And this aligns with emerging models like social prescribing, where community engagement is integrated into care. And there is growing evidence that social connection improves mental health, supports chronic disease management, and builds resilience. So, what if we stopped thinking of connection as something optional and started recognizing it as a form of treatment? And this is where institutions like libraries become incredibly important because libraries are trusted and accessible spaces within communities, and they already bring people together, which means they are already doing health work, whether we label it that way or not. You don't need a hospital to improve health. Sometimes creating a space for connection, that is itself a powerful intervention. What I learned from this experience is that hope is not something we give, it's something we build together. And if connection can heal, then building community is not optional, it is essential, and in many ways, it is medicine. Here are the references that I used for this presentation. Thank you for listening, and I'm looking forward to your questions.
Let's see. We don't have any questions at the moment in the chat. But I think an easy, nice one that might help inform some folks. What inspired you specifically to work with this challenged population?
So this was part of our first year curriculum as first year medical student. It was part of our community health course. We were actually assigned to work at Oasis as a group of students, but it was a lucky situation for me because I'm very interested in working with the elderly. I have extensive experience working with older population. Before medical school, I volunteered there extensively, and they're very dear to my heart. Um, this experience, however, reinforced for me the fact that I have to care for this population. And moving forward, I'm a third year medical student. I'm gonna apply to residency very soon, and I'm interested in working for the older population, specifically when it comes to the mental health aspect of healthcare. And I find that this population really needs a special attention because they are more vulnerable when it comes, especially social isolation is a social determinant of health that affects everybody, but it has such a greater impact when we are talking about a population that's already vulnerable because of mobility issues, because they're losing their their social network, because they have chronic health disease that they have to manage. So I think there needs to be an increased attention that we are paying to this population from a clinical point of view, but a non-clinical point of view as well.
Thank you so much. I think that lends a lot of context to it, especially within libraries. We too also work with this population, so this lends perfectly, which is why we're glad to have you here today. We did get a comment in the chat that they've seen social connection totally transform a close family member's mental health. So thank you for bringing this important intervention to light.
I'm so glad to hear that. Yeah, that's impactful. If there are any other questions, I'd be happy to answer. I can also leave my.
We do have a couple actually in the Q&A.
Okay.
Yeah. What do you think about the use of online communities to connect individuals who are experiencing loneliness, as well as the risks for those tools?
Yes, the risks are there for sure, especially when we're talking about older population who can be more vulnerable to, let's say, cyber attacks. And I'm talking about scamming but online communities can be a powerful tool in the right community. We tried actually implementing something like this in our community at Oasis, but the residents that we had there had a little bit of difficulty with technology. So that's not something that would have worked for them at that point. But as our as people continue to grow and get old, of course, maybe in 5, 10, 15 years, online communities could have a much greater impact than they have right now on a broader broader community. But right now, I think it can definitely be a powerful tool in the right community even now.
Thank you so much. We also got a question, and I know we're being cognizant of time. What do you think about the use of online communities to connect individuals who are experiencing that? Oh, I think they added to it. So not just mental health communities, but other communities online that might engage individuals with limited social networks. I think
Yes.
also it adds to on here for rural communities in particular. Some libraries serve very isolated rural communities.
I will go back to social prescribing. The social prescribing that I mentioned in my presentation, this is something that is extensively used in UK, for example. It has some greater presence in Canada as well, but in the United States, we have some pilot programs only. So it's gaining recognition right now. Hopefully, it can be used more. And in the UK, they are able to use social prescribing to address social isolation with art, um, webinars, music, even watching movies together. I think this
You're breaking up
using.
a little bit, Lulia.
Oh, okay, I apologize.
Yeah, and
Is
I just
it
wanted to
easy
let you
for you
know.
now? Okay,
Yes,
okay. Okay, so I think this is definitely a tool that could increasingly have a greater impact as we move forward, and uh, clinicians and non-clinicians as alike should make use of it. Hopefully, it can become safer uh, because of the environment that we have online. Hopefully, it can become safer and safer as well as we use it more.
appreciate that. And we did get another question on older patients. Have you noticed improvement in cognition amongst those who are avid readers and have access to library materials, such as through a local library in their facility or a library by mail type program, or those who can make music or art?
Absolutely. Research actually shows that reading is one of the tools that we can use to protect our brain against cognitive decline, like dementia. I don't know specific stats right off the top of my head right now, but I saw multiple research studies that show the impact that reading has on preserving cognitive abilities. So this is a huge area where libraries and books can make a big difference.
I think most of the librarians in this session are not startled to hear that, but it's nice to hear from a medical perspective that there is, it's being seen on your guys' side too. Someone also shared in the chat that there's a great program that I guess they use at their library called WITS Workout. And it's based on the research that intellectual challenge and social connectedness are two of several factors that contribute to brain health throughout life. So I think you would support
Absolutely.
that. Yeah. So,
Absolutely.
do we have any additional questions for Lulia? She will be heading out from us just a few minutes early. Um, and you do have your contact information.
Yes, I will type it in. If there are any additional questions, I would be happy to follow up via email. Unfortunately, I have a bit of a conflict, a rescheduled session at my school that needs my attention very soon, but I will share my email and I would be happy to follow up with any additional questions via email.
As you're doing that, and just to kind of help us close out where you go, what do you think is a nice segue for, medical students and libraries amongst like this? Is there any type of um, something that you would like to see between libraries, or what libraries can do with medical students?
Students would love any opportunity to be involved in the community, especially when we're talking about screenings, blood pressure screenings, diabetes, glucose monitoring. So I think there's a great opportunity to have a partnership between medical students and libraries. And the first thing that comes to my mind is organizing health fairs or having sessions. I'm familiar with the libraries around me, and I know that they have a lot of activities for elderly and for small children alike. So I think maybe from time to time using one of these sessions as a health screening, health education. I know medical students would love any opportunity to be involved in the community and extend their skills and apply their skills and learn.
And right along with that, someone asked, do you do any memory screening for older adults as a baseline?
Memory screening for older adults. We usually have some memory tests that we apply, like MOCA or mini mental status evaluation. We usually do not do this as a screening. We do it once a patient comes in with complaints of cognitive impairment, memory problems. So, as far as I'm aware, we do not do them as screening. We do them to evaluate the cognitive impairment once the patient complains of this. But it's a very interesting idea. I'll think about it, having it as a screening.
Screening. And then the last question, I probably for time's sake, is do you see any preference for language? Oh, two questions, sorry. Do you see any preference for language related to aging?
Any preference for language?
I think the person might be referring how to speak about this population, like, yeah, senior versus elder,
Yeah.
etc. Yes, they clarify.
Oh, we use recently, so I'm a third year medical student. I was in my first year when we were involved in this program, and we use words like elderly and senior residents routinely then, but now I understand the preferred language is older population, older adults. This is the preferred language.
Thank you for that. And then lastly, someone just mentioned they are currently forming a collaboration with the Alzheimer's Foundation for memory screenings at their library branches. So looks like that might be
That's amazing.
something to explore.
I'll look into it and I'll see how we can implement this in primary care. I'll look into that.
Right.
Oldster. That's funny.
Oh, Oldster. All right. All right, there's just some people adding some conversations into the chat. I do know that you were on a time crunch, so I will remain and I'm happy to collect and field any questions to forward over to Lulia so that she can get back to folks if there's anyone who thinks of something as you head out. But best of luck on your evaluation.
Thank you very much. It's been a pleasure. You'll have a great day.
Thank you.
I'm gonna stop the recording for now, after I do a slight outro from everyone. Thank you to Lulia for presenting today, and thank you to our audience for attending. We are committed to ensuring that SRRT programs are diverse, inclusive, and free for attendees. In order to do so, we rely on the support from ALA membership and direct donations. You can help champion our roundtable's mission and commitments by donating at the link provided and/or by joining SRRT as a member. You can make a general gift or select the SRRT task force or award that you would like to support. Please help us maintain our high quality programming, the core values that sustain it, and our commitment to accessibility by making a donation, becoming a SRRT member, or helping to spread the word about our roundtable and events just like this one. So thank you. And our next session for today is actually going to be in a little while. It is going to be culturally rooted and community focused initiatives to support Black and Indigenous maternal health. So if you are interested, hopefully you can join us. That will be again in a little while. I'm going to end the recording, but if anyone does want to submit any questions for Lulia, we will happily forward those along to her to get back to folks. Thank you again.